All right, I'm going to start. I'd like to thank everybody for joining us this Thursday, November 12th. It's the day after Veterans Day. I think it's very apropos of this discussion. Book Sandwiched In was started quite a while back, and we're reinvigorating it at the New Haven Free Public Library. It's an opportunity at noon, folks who can have their lunch and enjoy a great discussion with an author, various topics. And we're very fortunate today to have Andrea Mazzarino, who has co-editor of War and Health, Consequences of the War in Iraq and Afghanistan. Andrea co-founded Brown University's Cost of War project. She's an activist, social worker, interested in health impacts of war and in children and disability rights. She has held various clinical and research positions, including at the Veterans Affairs, PTSD outpatient clinic with Human Rights Watch, and at a community mental health agency. And also, I'd just like to say, Andrea, thank you for being here. It's as in New Haven, last week, we just passed a great referendum. I mean, most folks know, I think it made it nationwide, where just talking about what this book is about. It's a question posed to the folks in New Haven. Shall Congress prepare for health and climate crises by transferring funds from military budget to cities for human needs, jobs, and an environmentally sustainable economy? And this is what, hopefully this discussion will bring that to the light, and as you say, cost of war, what it really entails. Thank you, Andrea, for joining us.
Thank you so much, Seth. I'm happy to be here. Good afternoon, everybody. Thank you for attending our forum. I'm going to speak briefly about the book, War and Health, co-edited by Professor Catherine Lutz and myself. And then I will transition to a more informal discussion forum. These endless wars, as we just passed the 2-decade mark of war, the US war in Afghanistan, they've been on Americans' minds, and I imagine that many folks have questions and comments about what should be done about the public health crises spurred by these wars, as well as questions that they'd like others, including myself, to discuss. So this book grew out of the Cost of War project at Brown University's Watson Institute for International and Public Affairs. And the Cost of War project was founded in late 2010, early 2011 by political scientist Nita Crawford, anthropologist Catherine Lutz, and myself. And our aim was to bring together scholars, activists, medical professionals, lawyers, in a nonpartisan attempt to account for the massive costs of the US decision to respond to 9/11 with military force. And the project has now been almost 10 years old. It's now almost 10 years old. And it accounts for the costs of war in a whole range of ways, including financial, in terms of the human rights costs, and of course the human costs in terms of casualties. Around the time that Catherine Lutz and I decided to form this edited volume, we knew that hundreds of thousands of people had died in these wars. I think it was around 300,000 people total. We knew that thousands of troops and contractors had died, and many more had been wounded. And tens of thousands of people from the war zones, from Pakistan, from Afghanistan, from Iraq, had been displaced indefinitely. But what we knew very little about was what it was actually like to live in the war zones, and what the mechanisms were through which people were dying and becoming wounded and ill. I mean, there was limited data on infectious diseases born of war and the destruction of infrastructure from war. We actually didn't really know a lot about how people were dying in the war zones, especially civilians. So what we undertook was a project to paint more of an ethnographic, more of an anthropological picture of war and human health, and these wars in particular, the post 9/11 wars. We wanted to know things like what it was like to be a woman in Afghanistan giving birth after the US invasion. You know, had the US accomplished its mission of extending human rights to women, one of the original reasons we went to war in Afghanistan. We wanted to know a little bit more about what war had done to hospitals and clinics in Iraq. We wanted to know what it was like to be in a military family in the United States, even if your spouse or your loved one had not gone directly to these war zones. So we assembled a group of 17 very diverse authors from different backgrounds, different national backgrounds, different disciplinary backgrounds. And we put together this edited volume over several years. I wanted to share with you today that this book feels like a very personal project to me by this point, mainly because at the same time that I was starting to edit it with Catherine Lutz, I was a military spouse and a new military mother. And my husband was entering his 4th sea tour on a ballistic missile submarine. I never really knew where he went, of course, but I was getting sort of little minor shadows of what it meant to serve in the military in the post 9/11 era. He would come home for a couple of weeks and be sent back out to sea. He was serving under several different commanders who had themselves been to Afghanistan and Iraq and who were living with severe trauma, and who sometimes took that out on their subordinates through hazing rituals. And it was very difficult sometimes to be with him on a sea tour because it was never really clear what it was like for him to serve, and he had very few outlets within which to talk about his service, given the secrecy of life on a submarine. But some things happened, like he would startle at the sound of fireworks on 4th of July that made me think that all of the time that he spent thinking about what it would mean to have to go into combat in this era was just so much more than I really knew. And at the same time, I was doing a clinical internship at the VA at a specialty clinic where social workers and psychologists, I'm a social worker now, were treating combat veterans with PTSD. So I was getting sort of a firsthand look at what it was like for veterans and active duty service members to come home from the war zones and live with the memories of things that they had witnessed in the war zones and things that they had done. So that kept me up at night, and I wanted to understand more through the work on this book about war and its effects on health, and to make that more publicly known in a way that, of course, being a therapist doesn't allow you to do. At the same time, it was really clear that the US was becoming destabilized by acts of violence by far-right nationalists. In the very area where my family was serving, increasing numbers of Jewish community centers and synagogues were coming under attack by far-right nationalist groups. There was a lot of sort of bellicose rhetoric in the news, threatening war with North Korea. So talk of violence was all around us, and that made this book feel very, very relevant, even though it was about wars in another place. We wanted to make it very clear that war is not sort of a sterile contest between states. It's not about protecting human rights in most cases. It's not about liberating groups of people in most cases. It's a very gruesome, bloody nightmare. And the numbers alone, the limited numbers that we were able to get through work on the Cost of War project did not bring that to light sufficiently. So I'm going to talk a little bit about some of the surprising findings and the striking stories that came out of our book, War and Health, from the authors who did ethnographic research and public policy research on war and health. And my hope is that the folks who are gathered here today will be interested in reading more about that directly, not just in our volume, but in other people's work, such as the contributors of the Cost of War project, who continue to publish really fantastic stuff. I mean, one thing that stands out to me more than anything else about this book is that it's hard to be a woman in Afghanistan today for very clear public health related reasons. A nurse practitioner and anthropologist, Kylia Lutz, wrote our first chapter in the book, and she talked about, she served as a midwife for years in Afghanistan after the US invasion, and working with women in rural villages. And she highlights a lot of really important dynamics in Afghanistan after the US invasion. One was that while the number of healthcare facilities and in particular women's health facilities increased across Afghanistan in the years since the US invaded, it hasn't necessarily been easier for women to get healthcare and to have their children. So, for example, Afghans living within a 2-hour walk of basic healthcare facilities increased from 9% to 85% just between 2003 and 2009. But in many villages where Professor Lutz visited, it's a lot harder for women to access care because of the sectarian violence that's erupted throughout Afghanistan. So the Taliban was a force in and of itself, and they limited women's access to health care in many ways, including by restricting women from getting medical degrees and requiring women to attend clinics with male relatives. At the same time, since the Taliban, since we invaded Afghanistan in 2001, numerous factions have proliferated across the country, and it's never clear to people living in remote villages when another attack could occur. So many women prefer not to leave their homes, not just when it's time to give birth or go to medical appointments, but in general, even just to get water from a local well, because they fear sexual assaults, violence from armed groups, violence from far right groups who might attack them simply for being outdoors. So we lack information on maternal mortality that's complete due to limited access on the ground, but the increase in healthcare facilities in Afghanistan has not made it easier for women to get care and give birth, nor has it made it easier for women's families and loved ones, for men and children. Another really important chapter is by Anila Dalitsai on care and humanitarian aid programs in Afghanistan that aim to assist war widows and others in need of basic provisions such as food. And Professor Dalitsai tells the story of a war widow named Aisha in her 30s who lost a son in a suicide bombing while he was on his way to school, and who later lost a husband from suicide, and has to now make do on her own with her surviving son. And one of the key things to come out of the story of Aisha is that the more important, vital thing to her survival was actually access to heroin and other drugs that would enable her to just put one foot in front of the other on a daily basis. After surviving the multiple traumas of war and of losing her son and her husband, even though she lost access to humanitarian supplies such as food because she did heroin. And one of the things that I think is really important about Professor Dalitzai's chapter is just the fact that humanitarian aid programs might not sufficiently account for how traumatizing war can be to those left behind, and how essential any coping mechanism can be to just getting from one day to the next. So food is important, but so is psychological first aid and services that would enable people left behind to build resilience over time. Another important section of the book, of course, is coverage, is the authors who have written about Iraq and the decimation of Iraq's healthcare system since the US invaded in 2003. And one of our authors, Laith Mullah Hussein, is actually an Iraqi physician who has treated cancer in Iraq for many years. And he writes about the consequences of the US-led wars in Iraq and sanctions before it on Iraqis' access to preventative cancer care and to terminal cancer care. Dr. Mullah Hussein provides a lot of really rich information, such as the fact that, many, if not most, Iraqi hospitals lack chemotherapy drugs. They lack palliative care, such as morphine. And most cancers among Iraqis today are actually diagnosed in the later stages of the disease, after which it's a lot harder to treat or cure them. So this is a consequence, of course, of many different factors, one of them being the fact that US-led sanctions in the 1990s drained Iraq of really important supplies, such as chemicals used to make chemotherapy drugs. But also that air raids by the US-led coalition have led to the destruction of hospitals, to the flight of tens of thousands of Iraqi doctors and other medical staff. And there just simply isn't the infrastructure to treat cancer, let alone provide people with basic preventative visits in many, if not most cases. It's hard for me to forget an image that Dr. Lutz and I came across when we were starting the Cost of War project back in 2011. I remember we were looking for photographs for the Cost of War website, and we came across one of a little boy who had been severely wounded by a bombing, and he had open burn wounds all over his body. And a woman, perhaps a mother or female relative, was trying to carry him somewhere as he screamed. Not a photograph, I'm sorry, it was a video. And I never forgot that little boy, just because it was such a gruesome, such an awful image, and the scream was so haunting. And the other thing I never forgot was that we don't really know if he had anywhere to go. So as a mother, I really take for granted that even with our military's fragmented healthcare system here in the US, I have some place to take my kids when they get sick. But it's really not clear that this boy had anywhere to go. It wasn't clear who shot him or how. It wasn't really clear whether any of his family was left to care for him after he had been wounded. And the sound of that scream really comes back to me often when I read chapters such as Dr. Laith Mullah Hussein's, because he has brought home to us in this book just how fractured and in many regions destroyed Iraqi medicine has become due to war. Another author in our book, Max Skelton, talks about how Iraqis who can kind of scrape together the funds will travel to Beirut, Lebanon to get care in sort of these, at the American University of Beirut, which is sort of connected now with a whole chain of hotels and restaurants that cater to their needs while they're getting care. But that's a very small fraction of the population that's able to do that. And the lives of these Iraqis, getting care far from their homes and their networks really drives home to us how what was once the most advanced medical system in the Middle East has become uninhabitable for many cancer patients. And last but not least, care for military service members and their families is sorely lacking in our country, in the United States. Several chapters, including by anthropologists, Zoe Wool, for example, talk about how under-resourced the Veterans Affairs Administration and other services caring for veterans are compared to just how great the need is for the 2.7+ million service members who have sought care in our healthcare facilities. So for example, Professor Wool discusses the VA Caregivers Program, which might in fact have expanded since our book was published last fall. But at the time of her writing, she highlights that the modest stipend given to people who are caring for veterans with war injuries from the post 9/11 wars only extends to immediate family members, such as spouses or parents. At the same time, a significant portion, more than about a fifth of caregivers for veterans are actually neighbors and friends. So if you're a veteran living in this country and you're a paraplegic, or you're living with severe post-traumatic stress disorder and your neighbor's taking care of you, that person doesn't get support. That person needs to take care of you, pro bono, which is a tall order, and it's not sustainable. So that was one of the key insights from Dr. Wool's chapter, which is that the way that the VA and our healthcare system imagines veterans, they imagine them as, people seated within nuclear families with partners who are around and capable themselves of caring for them, which of course, often they are not, because they too are suffering from multiple repeated deployments with very, very small recovery times. Another chapter, and this is the last one I'll discuss, is by Jean Scanlon and Sarah Hautzinger, who talk about the effects of war when it's brought home by service members living in Colorado Springs, which is home to many active duty military bases. And they discuss, the strains placed on spouses who suddenly become, single parents who become, in many ways, depressed, and in many cases depressed and anxious themselves as they wait for a service member who might not ever come home. And then who have to deal with the returning service member coming home with severe war trauma, oftentimes, without necessarily those spouses, those loved ones being able to access care. What I really liked about Dr. Hautzinger's and Scanlon's chapter is that they talk about the stories of families, but they also discuss ways in which the Department of Defense and the VA could improve care for military families. For example, many veterans and service members wait for weeks, if not months, just to access therapy and specialized care to address war wounds. But at the same time, they don't need to, because there are providers in the community who could treat them, but who have to go through tons of bureaucratic red tape just to get certified to take military health care. So there are lots of things that the US government could be doing to serve veterans and their families and service members and their families, but they're not doing it. And there needs to be a much more comprehensive effort to support veterans and service members in these wars, because they're not over, and the health effects are long-standing and often invisible in the form of psychological injuries. So that is just a snapshot of this volume. One of the key takeaways is that war has ripple effects beyond the number of people dead who are officially documented by the US government, and even the Cost of War Project. And we need to study as much as we can stories from people, from journalists, from academics who have been to these war zones, and focus on the foreign policy and the domestic health policies of our legislators, so that we can vote in a really informed way and support people who have lived through these wars.
Thank you, Andrea. Just want a comment. It's interesting. I had been in Afghanistan in '91 to make a documentary, or it's like self-finance. And it was such a tragedy, because there was a point when Russians had left, and the Afghans I had met, my hope was to meet Najibullah, the president. I was progressive, and it was, reaching out to the US and saying, listen, enough of the war, stop sending Stinger missiles, stop supporting the Mujahideen. But for me, and you want to call it PTSD, but I wake up sometimes, the visions when I was visiting some of the hospitals that dealt with folks who were victims of landmines. I think you went to look. I know Jody Williams. I mean, there was a concerted effort. I think she won the Nobel Prize, but people don't understand. It's just a worldwide scourge. I mean, it's like you say, in terms of cost of war, the after effect, and the millions out there. Certainly, a lot of groups are making some concerted effort, but you're right, and it's just, people, I think it was a German company. It was interesting. The fellow I met who was making prosthetics was saying it was a family tradition. His great-grandfather in World War I made prosthetics for World War I victims, and his father, this was 91 victims in World War II, and it's just this tradition. I said, when's it going to stop? He said, maybe it's, he said, this is our business. I don't get involved in politics. And I go, whoa, where do we, like you're saying, it's innocent civilians, to see Afghan women who have just no support. When I see them, it was the Indira Gandhi hospital that was still open before it got bombed by the Taliban. Just the fact that the Indians, the Taliban are against India's support for Afghanistan, so they had to take, a retaliatory measure. This was many years later, but see people, basic things who were just women who lost husbands and just coming in, nutrition related. And so these things, you're right, which we don't see as Americans, and that's why I thank you for this book. And as I said before, initial discussion, I'm hoping every library will have it. Everybody who pays taxes will read it before, and just see where your money's going. It's, we struggle. I look at my own, library workers that we have to balance. We don't have money that could, some, weapons of mass destruction. We're, deficit, whatever minimal amount that could just pay for anybody. Citywide, the infrastructure is going kaput. But so there's hope around the corner, I guess, the new administration. But anyways, I wanted to say, any folks, if you have questions, now's the time. I don't see any questions. Please, chime in. Anyways, No,
I would like to know what hopes folks have for the new administration that's coming in terms of their handling of these wars. Democrats have not necessarily been pacifists. I mean, Obama was fairly hawkish in the Afghanistan-Pakistani borderlands. So I wonder what hopes or concerns people have about a Biden administration.
right. I think the drone issue, that was, I mean, it happened on Obama, it happened to Trump. It's sort of, it's a sad reality. It's, yeah, it's a hand up. I see somebody. Oh, I see a question. Oh, sorry. Let's see. Okay, some library director. I've learned so much and I'm going to buy the book for our library. Okay, great.
Great, thank you.
Which library is that? Do you, library director, or is that kind of? So, Andrew, maybe I can ask this. I know, what's, in terms of cost of war project, what are plans for the future, or what's any going forward?
So I am not directly involved anymore with I'm a contributor. I write pieces from a perspective of a military spouse and a former co-director, but I think Catherine Lutz, who just asked another question, right, can speak more about that. And then I'll address her question.
Would you like, we can bring her on if we want.
Yeah, let's bring her on.
Yeah, and I think Shannon would have to enable to, let's see, hold on a second. Let's see. Wait a minute. She's still, is Catherine still here? Catherine?
Yes, here I am.
Oh, great. Yeah, hi, Catherine.
Hi. So, yeah, no, this, Andrea's work on this project has been just so pivotal, so incredible. And I was delighted to be able to work with her on the project from the beginning, but also on the book. In terms of what the other goals of the Cost of War project are, we've been continuing to publish lots of papers on a whole variety of aspects of the war and its consequences. Health is really number one, but we've also looked at things like the working conditions for contract laborers who are brought in from all over Asia, and in particular in the Middle East, to work on U.S. military contracts in Afghanistan and elsewhere. That just is one example. But what we're trying to do is to get more of our data into the hands of groups who are doing the work on the ground of trying to change policy and make these wars both end, but also less likely to reoccur in the future. So we're working closely with more civil society groups who are peace groups, social justice groups, and making the connections between war spending and the situation of everybody from the libraries of America to the our transportation sector to our Food and Drug Administration. I mean the ways in which the terrible trade-offs that have been made can be reversed in the future. I mean, and that's where Andrea's question for the audience about what people hope to get from the new administration in that way is really a great one. I'd love to hear as well. But we're working in Washington and with these civil society groups to make sure that our information doesn't just sort of help people understand, but help change happen as a result of that understanding. I think Andrea's so eloquent on this, the idea that war is a bloody, gruesome nightmare, to quote her, is still not really fully understood by so many Americans, and certainly the policymakers who talk about it when they're, doing defense budgets each year, or deciding on these trade-offs. They have just such a hygienic view of the wars, that make it seem like it's a sensible thing to be investing in.
You had an interesting question about explaining the idea, indirect death idea to us. I don't know if you addressed it. That was really, Catherine, you had mentioned that. Oh.
Yeah, well, I don't know if Andrea wants to do that, but we've actually been trying to do more work. We're going to have a conference next year, with a group of experts, on indirect death, some of whom Andrea's helped us identify around the world. And those are people who have studied not just the people who died directly from the bombs and the bullets, but the people who die indirectly as a result of war. They're people who are dead only because there was a war, even if they didn't die from bombs or bullets. And Andrea just gave several examples, from the book of how indirect death, war death happens. Indirect war death happens when people who normally would have gotten health care cannot get on the road because the violence makes it impossible to get on the road to a health clinic where they would give birth more safely. And so their infant dies or they die in childbirth. So those are the kinds of processes, the sort of pathways by which war kills people, even when, and sometimes years and years later, right? That sewage treatment plant that's bombed in Basra, Iraq, and doesn't get repaired, can be killing people through dysentery and other diseases of that kind of lack of sanitation years later. So it's wars can end officially, but the death can keep happening as a result of war. So understanding how that happens is one of the goals of this book, and something that I think we should all understand, have a better understanding of.
Thank you. Just, we've got two good questions. I just want to say thank you. The director is from Rosebud County Library in Forsyth, Montana. So it's good to see we're this is being broadcast over the country. And thank you, Montana, the great state of Montana. A question from Emily Rush. Do you think it'd be helpful when dealing with these health atrocities to have more veterans or active duty military in public office?
That's a great question. And I think that the answer is an emphatic yes. And I would add to that there should be service members or veterans who are people of color, who are transgender, who are gay or lesbian, are non-binary. And there should also be the military spouses in public office. I think that the people who care for returning service members and veterans are really facing many of the health effects of war in the US most directly. And they would have a great deal to say about health for service members and veterans, but also about foreign policy and the consequences of war, because they don't just hear about deaths and injuries among US citizens who fight and contractors who fight. They also hear about children getting shot at, the effects of war on disabled people who are with disabilities in the war zones. They hear about war and all of its gruesomeness, and they could speak in a very important way about the way war affects people and infrastructure.
Yeah, let's see.
Yeah, I would add to that, this is Catherine again, I would just add to that when we've gone to Washington, as we have increasingly over the last several years with the Cost of War Project, the people who are most eager to meet with us are veterans in, some of them are veterans in the Congress right now, and they've been some of the champions of taking a harder look at our foreign policy, our military spending, because they understand it, up close and personal in a way that most Americans don't.
We have two other questions. You want to take those? Or?
Yes. So one is by Isaac Shub. I noticed in reading one of the chapters on Iraq that a certain area had something like 12% food insecurity. I also recently saw a report from 2019 that food insecurity in the US is 10.5%. It's obviously difficult to compare two isolated statistics, but is there a connection to be made between hunger in the US and hunger in Iraq, Afghanistan, our war zones? I really like that question because of a recent op-ed actually that Dr. Lutz and Dr. Crawford wrote for The Hill about the way war has decimated the US ability to address the COVID pandemic here. I mean, I don't know how related hunger is in the United States to these wars, but it's really clear that the US was not prepared to fight this pandemic, and that our lack of preparation could have been addressed had we not spent, over $6.4 trillion to fight these foreign wars. So I wonder how robust our humanitarian response would have been in the US had we not engaged in wars in these foreign lands. Maybe Kathy Lutz wants to speak more to that.
Yeah, no, absolutely. We have had, the argument's been made that we can't afford the can't financially afford the kinds of stimulus that are needed to deal with both, providing them for the medical needs. I mean, the hospitals that are completely swamped, the need for PPE, the need for ventilators, the whole range of things, and then the economic fallout of the virus. The amounts that people are talking about are phenomenal large amounts that are needed, but they are just a portion of the amount that the United States has spent in Iraq and Afghanistan. So that's money that if people are worried about our deficit, and when they talk about the stimulus bill, all one has to say is, well, if we had not fought those wars, we would have plenty of room to have this kind of emergency response, which is, again, leaving people are already being evicted, people are already suffering in their mental and physical health in ways that go far beyond COVID as a result of the economic dislocations. And again, the choices that were made for the last 20 years, it's almost 20 years now since 9/11. And that's just, it's phenomenal that those choices still remain relatively unquestioned.
Then the question from Maria, you've got that. I think you're muted, sorry.
Yes, sorry about that. Did you find out if there were successful social justice health support groups among local women in what geographic areas? I'm really glad that you asked that question. I would say that our authors' focus tended to be mostly on sort of the informal ways in which families and neighborhoods supported one another in the war zones. So the extended family in rural Afghanistan who assisted with childbirth, for example, or in Kabul, the women who supported one another when some didn't qualify for food aid because of drug use. But one chapter that I wanted to highlight was Patricia Amidian's and Catherine Panter-Brick's chapter on humanitarian workers who were local in Afghanistan and Pakistan, assisting refugees in the borderlands. And the focus was not necessarily on how effective they were, but on their lived experience dealing with their own safety risks and trauma of doing their work in the highly unstable borderlands where the threat of violence was daily. So that chapter was sort of a taste of how local groups have risen to the challenge of assisting their neighbors, but and many of them are women. But that would be a really great topic in and of itself, and maybe Catherine Lutz can speak to whether the Cost of War Project is addressing it.
Yeah, I think one of the things that we are very keen to do in this upcoming conference is to have experts from Iraq and Afghanistan who can speak to that question of how, not just of the death and the direct and indirect death and injury toll, but then what is being done. Some of the organizations who have the best view of the damage are those organizations, international and national, that are working with everything from providing prosthetics to dealing with mental health issues, to dealing with the challenges of childbirth in these very unstable and violent conditions. So those are folks who we hope to learn more from about exactly that question, which is great. But yes, certainly the local response has been extremely vigorous in the sense that there is not enough help coming from outside, for sure. And the sort of the whole idea of reconstruction is something that the Cost of War Project has also looked at more closely. The money that has been spent on reconstruction, which is theoretically about dealing with the health impact of war, right? You got to reconstruct your hospital system, your primary care system, your access for the disabled, and so on. But in fact, most of the U.S. reconstruction dollars have gone to reconstruct, quite bizarrely, the police, the prison system, the court system, but basically security, the security workers, their salaries, their equipment, that has the bulk of the money, not the healthcare worker training. Also, lots of money has been invested in the infrastructure, the visible infrastructure of healthcare. So building clinics, like building schools, but then the people to staff them, the ongoing operational budgets are not there. So it's in some ways looks like a Potemkin's village of healthcare, a kind of a it's all in some ways for show for the people back home who in the United States who are putting that money in, but maybe not having enough care or knowledge about what those dollars are in fact doing for the very real problems day to day of health, the health needs of the Afghan or Iraqi population. If anything, all that security spending is also making, creating the conditions for a more militarized Iraq and Afghanistan going forward, one in which, again, the argument can be made that they're providing security, but often those military or paramilitary investments are being used against the population itself.
There's a lot of kleptocracy there. I think
Yeah.
it's quite sad. I think, well, I'm not singling out the UN, but in terms of the, what was it, little scandal, I think the Afghan mission to the UN. I mean, they built this luxury, I mean, how many millions for whatever that new building or the apartment. And because the ambassador, I remember meeting him in what's his name, Bashir Tanim, and now he's the ambassador. But it was a newspaper ran. He was like independent, El Sabayun. And I mean, he had high hopes for, this was the time of, Najibullah in the 80s and 90s. And there's going to be some change before the Mujahideen took over. But I just want to, reflect. I mean, it was fascinating being there in '91 to see the women's organizations like, what was it? Well, I think the changeover, there used to be, the party was the People's Democratic Party of Afghanistan, but it changed to Watan. But women, it was so really enabled, I mean, in key posts, I mean, just to walk into wherever, UN headquarters, the bank, and I forgot the woman, the film director did a documentary about women, the history of women in Afghanistan, and really, even in the 70s, 80s, 90s, really, well, early 90s. And then this took place. I mean, it's horrific. I mean, the war. We can thank Brzezinski also for, under Carter, and sort of funneling it and just trying to cripple them and create another Vietnam for the Soviet Union, which they really don't want to go into. So 40 years of this, it's amazing. It's just never ending. I'd like to end on like a positive note. If nobody has any, I mean, I guess I should ask Andrea and Catherine, what hopes do you see? I mean, hopefully new administration. I mean, I'm biting my tongue, but, as we end this discussion, what, folks are on this program, what can we do? Or your thoughts, some closing ideas?
One of my thoughts would be just to vote with knowledge of, the foreign and healthcare related policy of everybody up and down the ballot. So follow the Costs of War Project and their contributors. I think it's the most valuable source of information on these wars when it comes to the subjects we're talking about today. And I really hope that the Biden administration, the Biden-Harris administration, does take into account not only the insights from the project, but also insights from local actors on the ground in the war zones in their reconstruction effort, and that the rebuilding of schools and hospitals that are so essential to health takes place through coordinated government efforts and not through the efforts of contractors who are far outside of the scope of oversight in many cases.
Catherine, do you have any thoughts? Oh, yeah.
Yeah, I would just add that absolutely, it's in our hands theoretically as a democracy to have our political leaders follow our sentiment, and I think American public opinion at this point is very much one in which people are open to the idea of cutting back on foreign wars and to cutting the military budget. The political leaders have really lagged behind the public in its wish to see many more dollars spent on healthcare, both here and in terms of reconstruction over there, than on nuclear weapons development and the sort of constant interventionism. But as Andrea said, at costsofwar.org has that website has lots of information about how to understand the connections between here and there, and what the health consequences of these wars have been for people in all three places that our book tries to bring a human face to. Those three places being the US, Iraq, and Afghanistan.
Right. Yeah, and it's I hope any library folks, when people come in, I hope they'll direct them to the site. And of course, one last pitch, please buy the book, have it in your collection. If you have a wedding, bar mitzvah, anything, it's a great gift. I think people should read it. It's And hopefully, I hope Andrea, Catherine, you'll be part of the Biden administration. If someone across the war, be a sigh of relief for me, it'd be knowing that there's some great people. You know, it's interesting because he tapped Jared Bernstein, who was, I don't know if you know, Economic Policy Institute. So let's hope so. Bringing more progressives in, it'd be really great sign of the time. So thank you for joining us. And oh, good. And our next book sandwiches is The Alchemy of Us, December 10th. I hope everybody will join us. You can just follow New Haven Free Public Library for upcoming events. And Andrea, thank you so much for participating. And Catherine, thank you for coming in late. But it's really great having you.